Hi, ladies and gentlemen. Welcome to this edition of the Cameroon Town Hall for Healthcare Professionals, and Happy New Year to everybody. Happy New Year to all the co-moderators, and Happy New Year to our chair, Dr. Monoken. Happy New Year to our guest for today, and Happy New Year to all our fervent participants of the Cameroon Town Hall for Healthcare Professionals. We are so happy that we are starting this year with another edition of the Cameroon Town Hall for Healthcare Professionals. Last year, we celebrate the fact that we went through all the 365 days of the year without ever skipping a single session of the Cameroon Town Hall sessions. This is amazing. Congratulations to you, Dr. Munoken, for making this possible, and to all the moderators for always showing up to handle these sessions, and to all our participants who have made sure that we keep the rendezvous every fortnight to this very important gathering, which has become like a family. I hear Kenji from California says the town hall is becoming addictive. So that you feel like when you miss a session, you feel like something is wrong somewhere. I want to thank you all for being part of this great family of healthcare professionals. Today, I shall be moderating with, I see Christelle. Christelle is here. Christelle, bonne année.
Bonne année, Elvis. Bonne année à chacun des participants. Bonne année au chairman. Et bienvenue à chacun à cette première édition de la nouvelle année 2022.
Great. And of course, Brian Tegomo. Brian, Happy New Year.
New Year, bonne année. It's good to see you in 2022.
Great.
And everyone.
I love your 2022 look. Really, really different. And I want to really thank God for making us see this new year, and for tuning in again for another session. We have Luisa Viban. Is Luisa tuning yet? Okay, and of course, our chair, Dr. Monok, and Happy New Year.
Happy New Year, Elvis, and it's really been a wonderful past 2 years with this whole idea started as a COVID-derived idea, but we're taking into all the fields of healthcare in Cameroon. And I would like to also welcome Teresa for being one of the co-moderators. I know last time she moderated with Allison here, and it was really great having her too as part of the team. So Elvis, I think today would try as much as possible. You know, the Cameroon Town Hall has been for healthcare professionals, and we want to know exactly what's happening in the field of nursing back home. Try to talk about what really we can do to improve and advocate for nurses. I think this is the beginning of several series that we're going to talk about the importance of the place of the nurse back home. And a lot of people really don't understand in totality what can be done back home to improve the health of so many people back home. I think you're a public health expert. You're also a nurse by profession, and we're having a good discussion today about home health services.
This is really exciting, Dr. Monoken. When you discuss with Innocencia and she accepted to be our guest, I said you have just brought the best person to talk about this or to initiate this conversation that will bring forth many other nurses. And I really thank us all for the inclusion and diversity that we have on this platform. And Teresa, it's a pleasure to moderate with you here for the first time. I heard you did a marvelous job last time. I'm happy you joined the crew, and we are so excited to see you. Happy New Year.
Oh, Happy New Year, and thank you so much. I'm so excited to join the group, and yeah.
So among us, all the the 4 moderators and chair, who had Omicron in December? Who got infected?
I did.
I started with myself.
I did, and Allison did too, so.
Allison did, yeah. Okay. So 3 already among moderators. Brian, did you? Not yet.
No, I have not.
Mono, did you?
Not yet. I may have had it, but for some reasons I kept testing and it kept testing negative. So
Right.
it's, yeah. So
So
my wife did have it, but she was had a very mild form of the disease, but that's why I kept testing.
so
And,
despite 2 years of this hard work, the COVID-19 virus was not afraid of us, was not afraid of the moderator and Dr. Christelle and, Teresia. This is terrible. But of course, Brian, you will tell us how we can do to make sure that these, variants stop, emerging. And I know you're very interested in, surveillance on all the, on all the different variants. What can you say is happening before we get to the main subject? What do you think there's going to be another variant soon?
Yeah, absolutely. It's very likely. I think globally we need to reinforce genomic surveillance systems across the world. The virus will definitely continue to evolve. There's increasing hypotheses that this might have evolved through an immunocompromised person because they shared viruses for longer periods of time. So the virus has the opportunity to mutate and accumulate and have so many mutations. So I think the issue with Omicron is the fact that it accumulated so many mutations in a very short period of time. We are used to a mutation rate of approximately 24 mutations in 1 year, but the skip from Delta to Omicron was extremely huge. And those hypotheses of immunocompromised and the likelihood that this might have also been a cross-zoonotic event, I think Boguma talked about this also as well. So I think it's likely that we will definitely have more, we're likely to have more variants evolving. Just reinforces the need for more and more genomic surveillance systems. Sequencing is not happening in areas where transmission is taking place. So we really need to expand our technologies throughout the world, in Africa, in underserved areas as well. I think that's going to be crucial. And just to make the point that it's still difficult to know what variant you are being infected with. You can, Dr. Mono can say that, oh, if I was ill because there was a surge in New York, and New York was predominantly Omicron, it's still difficult. In the US, haven't made the decision to let people know that they're infected with a specific variant. You can make those assumptions, but you can't specifically tell. We don't tell patients, we don't share that information directly with patients. Maybe there's still a decision whether or not that's going to be done, but we're not really sharing. People don't really know. You can make assumption that it's becoming the more predominant variant, but once you're infected, you can't, we don't really disclose what particular variants or mutations are present in your sample.
Do they know?
If they know, yes.
Do they
so
know?
there is surveillance going on, so they do know. We do know in the state level, we're able, because there is samples are sent to the central level. So we do know the prevalence. That's more of an epidemiological surveillance in the state, but we don't, in clinics, we don't tell patients what you have, but we make decisions based on the surveillance. In New York City, actually, Omicron took over Delta really, totally. That's the situation in the city of New York. So most public health decisions were made based on that assumption. But there is it's an ever evolving field of knowledge in terms of what we do in the hospital, public health measures. There's still debates, there's so a lot. I think Dr. Boguma covered a lot last time. I think she was ahead of her time, and everything actually unfolded the way it was predicted, that it's a more infectious variant. So it took over Delta in most parts of the country, but there is still Delta circulating. Its data is coming out to show that it's less severe, the pathogenicity. There's a lot of data backing that from the UK, from South Africa, which has done a terrific job. We have to congratulate South Africa for their level of surveillance, for the level of quality data, for the level of public health. It's an African country that is doing a marvelous job and should not be punished for actually being able to diagnose and tell the world about a variant. The fastest that was ever documented was done by South Africa among all the other variants. So it's very marvelous, and I'm very proud of what they're doing over there in South Africa. So, but when it comes, the implications of this really is more in treatment There is an implication in monoclonal antibodies, which a lot of those what we have now don't really work. There is an implication in trying to also polarize PO medications, which are available, but the stocks are low. There is also a debate on who is going to get treatment based on what we're seeing. Looking even at confounders, is it just because we're vaccinated everyone, that's why people are having less severe disease, but it's not, it doesn't look that is the case. It looks like intrinsically, Omicron itself is less severe, but more contagious intrinsically with that, because they have done a lot of subgroup analysis have been done, and that's what has been found so far. And the question is, I think 2022 is going to be the year of oral medications and the year of a second generation vaccine. I think that's really what 2022 is going to be. There's going to be a lot of oral medications. This is going to become, and the year of really trying to question public health in this country, even in the US, trying to make sure that we fix the CDC, we fix the FDA. Those are all structures that need to be fixed, because it's really one of those things that if we look at the UK and the quality of data coming out from the UK and also from the European Union, even from South Africa, we tend to feel that there is a problem in this pandemic we're not talking about, which is really the CDC itself. So, but that's a debate for another day, Elvis. I think I don't want to spend all the time. We need to go back to our subject.
Thank you very much. And know that there is a very strong CDC representative among us who can also have his own voice to say. One day I'll bring two of you on the debate, and that'll be an interesting session. And we have Dr. Dita Ivor with us here today. Happy New Year, our own Dr. Dita. Happy New Year.
Oh, thank you so much, Elvis. I didn't know you were going to be inviting me to speak here today, but I'm really happy to be back on this forum. And I thought the subject of today was going to be very interesting, so I made sure I find some time to be here and be part of it. The previous speakers have already highlighted this threat that we are dealing with, which is the COVID-19 pandemic, and I agree with all of them. And I mean, the evidence that we have out there certainly says Omicron is more infectious, but thankfully less severe. And we cannot stress enough the importance of getting vaccinated. We know that if you are vaccinated, you may not be protected from getting the virus, but certainly if you get infected, you're less likely to have severe disease or end up in the hospital or get a tube down your throat, and worse of it, to die from the disease. So please get your vaccines, get your boosters. That's all we have for now, as we look forward to, as Dr. Muno predicted, that we're going to have a lot of oral therapies and hopefully a new vaccine that we will not need to be taking every 3 to 6 months. We should, in the meantime, focus on what is available, and that's the vaccine. So thank you guys very much. You guys are doing a wonderful job, and I look forward to the discussion.
Thank you so much. And this is part of the program. The Cameroon Town Hall always starts with updates on COVID-19. And so we decided the updates to be in this format just so we can listen to other people. And of course, let me end the updates of COVID-19 with Kenji. Kenji, you are the head of the virology lab at Stanford Hospital. You've been one of the key persons that is managing the testing. Are you tired testing? Should we continue to test?
Elvis, I'm really tired, as you can get from my voice. Yesterday, we did like 4,000 to 6,000 samples. It was so disheartening when you see 27% of those samples being positive. That's something we've never seen since COVID started. I have one of my departments where 10 of the staff are out due to COVID. So it's really weighing down on us, but we have to keep the momentum. We have to keep testing. Because as you know, testing is like the first line for you to be able to fight a pandemic. If you don't know, something is difficult to fight an enemy that you don't know. So it's unlike before, you know, everybody is tired. We thought that by now we could have bid farewell to COVID, but it's still around, right? So it's just for us to continue to get our vaccine, get boosted. I was just making a joke with my boss yesterday that COVID status is no longer PHI. You know, gone are those days where somebody had COVID and it was like big news. But now it's like almost everybody. I had my own dose of it too in December. I know you were asking people that had it. I also had it in December. So everybody around is like having it. I think we are gearing more towards seeing COVID more like an endemic, disease. Probably it's not going to go away totally. We just have to learn how to be able to live with it and continue with our life. Thank you guys so much. I hope you guys have a wonderful 2022.
Thank you so much, Kenji. And we want to say we are so proud to have you here, and you're always tuning into this session. Thank you so much for your availability. And now is the time for us to meet our main guest for today, Guinea Innocencia Kuala. What a pleasure to to meet my own grandsire on a platform like this today. She is a nurse and a very, very trusted authority in the field of nursing in Cameroon. With so much of experience she has gathered across, her career in nursing, but now trying to innovate in this profession to bring in some, new aspect of nursing and dynamics that we've not had back home for some time. And so we shall be discussing, this very interesting topic today with Kuala Innocencia. Please, I don't know is it possible for us to see your face, but if not, then we don't mind. We already saw the posters and we know how you look like, but people might want to see your beautiful smile.
Hello. Unfortunately, the bandwidth is terribly low. I don't know whether you're getting me.
Yes.
I keep popping in and out, and I tried putting on my video, and it just went off, and I signed off. So that's the situation in which we find ourselves. I'm sorry about that. And if I have to do that, then maybe it's going to disrupt. But I bet by the end of the presentation, when there's nothing at stake, I'm going to do that. Thank you very much.
Thank you. Christelle, vous pouvez lancer la session de cette jour. Quelle est votre impression de ce sujet? C'est important pour nous, pour aujourd'hui.
Oui, merci Elvis. Merci à la grande sœur d'Elvis d'avoir accepté cette invitation qui est pour nous importante. Et aussi, comme le disait le chairman, on a longtemps eu à discuter des sujets avec des confrères médecins et tout. C'est important aussi de prendre cet aspect du nursing, de la prise en charge des familles, de nos familles et des activités innovantes dont celle dont va nous parler Innocencia aujourd'hui. Donc, je crois que c'est un sujet d'actualité et je suis très ravie de savoir, de partager avec elle son expérience et savoir qu'est-ce qui se fait et comment on peut l'améliorer. Merci.
Merci beaucoup, Christelle. And Therese, what's your impression about this topic before we introduce our speaker?
I think it's a very impressive one because we don't hear about it a lot in Cameroon, and we hear about it here a lot. So it's very impressive and it's very eye-opening, and it's very informative. It's gonna open our eyes so we see that we have something like that we need.
Yeah, thank you so much. That's really true. Nursing is a very important, the foundation of healthcare services in every setting that we find ourselves. The nurse spends more time with the patient. The nurse is always the one that can gather more important information from the patient that can guide decision-making in the treatment or in the whole continuum of care for the patient. And so taking nursing to the home of the patient is another aspect of care that has for so long not been implemented in Cameroon, but which we think is a very important aspect of care. Considering the turnaround time that people spend in hospitals, sometimes it discourages a lot of people from just going to hospital to seek care. But then just having the opportunity to have somebody come to the comfort of your home and offer care is something really amazing. And we shall be getting some of the details on how this is done and how this can happen in our own country from Kuala Innocencia. So I'll have the pleasure to call on our chair, Muno, to just read the bio of Kuala Innocencia, just so we know who she is and what she's been doing. Muno, is it? Okay.
Yeah. Well, so Kuala Innocencia, by introducing her, she's also an elderly sister to me who inspired me. Actually, the fact that I'm sitting here and doing medicine, she's one of those who's responsible. So I've known her since childhood. Extremely brilliant. And she was one of the pioneers that went to Boya that I know of to do nursing. Then it was, she was an inspiration in my, at the level of ordinary levels to the level of advanced level to the level of even getting into the field of medicine. And she has devoted her life for advocating for the improvement of nursing in Cameroon as a whole, advocating for us to try to see nursing in a different light, to also for nurses to valorize themselves and be able to understand that in nursing, there are subspecialties in nursing. There are things which nurses do beside just what the layman looks at. So she has been that big advocate. And recently, she has been carrying out activities before 4 months ago, where the activities were meant on promoting the field of nursing all over Cameroon. And she has had numerous international recognitions. I don't have any CV in front of me right now. I'm just telling you what I know about her. She's one of, and recently, the past 4 months, she has been engaged in, after studying and looking at what is happening back home, how our loved ones find themselves with the new immigration and the new tendency where most children are moving back, are moving abroad, and also most children are leaving their parents back home and they are unable to be taken care of. We do know for sure that nursing care is the basics of medicine. So she came in with this innovative idea, which I'm still going to learn part of it. She's going to tell us how to actually bring care to the home. And that is what she is. She's an innovator. She's a change maker. You would learn to see and know her and also admire her. Is someone to work with and is someone to trust. So I just want to thank her too for being an inspiration for us when we're young and showing us the way forward. So truly, this is more of an emotional speech. And Elvis, I thought you were going to introduce her, but you gave it to me, but that's fine. I was not prepared for it, but I just want to thank her for everything. And truly getting to invite her here was one of the things I really wanted to do at a certain point, and just to get us rolling with the field of nursing and talking about nursing, Elvis.
Yeah, thank you so much for introducing her. I knew you were going to do it in this very sweet way. Thank you so much. And I know I would want to tell our audience to bear with us. We are going to have some challenges with connection because Innocencia is in Cameroon right now and in an environment where there is some challenges with the quality of bandwidth that she has. And so she is, tuning in and out of the session, on, I think I would want to check to see if she's back. Innocencia, I think unfortunately, she's just got disconnected. We will be rolling while hoping that she gets to join us. And just to trigger a little bit of conversation as she struggled to get back, Bamuno, you keep your eye on our screen to see when she gets back so she can take it away from me before she gets off again. One of the issues about nursing in Cameroon over the time that we have been struggling to talk about and to see how to address, which I think will be a subject for another discussion, is the training. Because Muno, you just mentioned that there are subspecialty in nursing. How much of this subspecialty are known by the nurses themselves, and how many of these subspecialties are being offered training in Cameroon? The first thing that is a trouble with this profession is how disorganized the training in Cameroon has been. And that is what happened when you have a profession that does not have an order on its own. In Cameroon, we don't have the national order for nurses like here in the US or in any other country where you think that is the professional body that is supposed to regulate quality of practice and also regulate, those who join the profession and that certify them and give them licenses. In Cameroon, we have what is called the Cameroon Order of Nurses, Midwife, and Lab Technicians. These are three different professions put together, and sometimes it's very difficult for whoever is at the helm of this organization to regulate the practice of nursing. And when you look at who trained nurses in Cameroon, we see the University of Buea was a pioneer university that started offering the first degree in nursing. And this was not up to, I think, just about 20 years ago. That was in the early 90s. And this is a profession that had existed in the country for more than 40 years before it could have the opportunity to train people at this higher level of first degree. But then those who had been training at the level of state registered nurse, which was a 3-year program, there was a reorganization of the sector in Cameroon, and they said, okay, we have to train only a nurse assistant, a state registered nurse, and a degree nurse. But because of this competition in who trains the nurse, we had the Ministry of Public Health training the nurses. We have the Ministry of Vocational Training opening opportunity to train nurses. And we had the Ministry of Higher Education offering authorization to train nurses. And now this is where the disorder set in. You have some that are called, how do you call them again? You have some they say they are highly professional nurse. I mean, there are some terminologies they use that does not fall in between the nurse assistant, state registered nurse, and the BSN nurse in Cameroon. So they call some of them HND nursing. Some of them, they call them HPD nursing, or higher professional diploma in nursing. And now you see the Ministry of Public Health offering training. You see a Ministry of Vocational Services offering training, and you see the Ministry of Higher Education offering training. So training is disorganized mono. And for us to start talking about who does what and the different subspecialty, we will find an opportunity to revisit the aspect of training in nursing in Cameroon, because it starts from there. If training is organized, those who enter the profession at least know the pathway, their professional pathway. They know you can be a state registered nurse. They know you can train a subspecialty to be maybe in pediatric nursing. You can maybe want to get into other aspects of nursing like med-surg. You want to get into different aspects of nurses like mental health. But as of now, we do not have those subspecialties because of the aspect of training. So I know Kuala Innocencia today was not going to talk about training, but just to paint a picture of what the situation looks like in nursing, in this profession of nursing in Cameroon. I'm sure by the time she's telling us about the subspecialty that she's interested in, or the aspect of care in nursing that she's interested in innovating, we would have had some baseline on the thoughts of what is going on. And maybe I want to call on any nurse who is tuned to this platform to share his or her idea about what nursing feels like in Cameroon as of now in terms of training and in terms of practice. I see, let me see if I can catch my eye on some of those people. Aya Abongwa. Aya Abongwa is a nurse, and I want to hear from her.
So it looks like Kuala Innocencia is in, but I sent her another link, so she surely got it as someone else, but she's in.
Oh, great. So then before she comes in, maybe Aya Abongwa, you want to say a word? You have some few seconds. Okay, then I bring in Kuala Innocencia. You can share your screen and the floor is yours.
So
yeah, we can see your screen now. So you want me to?
I think the mic is muted. If you can unmute your mic.
Hello, can you get me, please?
Yes.
Yes.
Hello.
Yes, we can hear you, Innocencia.
Hello? Hello, can someone hear me?
Yes.
Yes, we can hear you.
Okay, thank you very much. I'm really sorry about the state of the network. The internet connection has not been very fair to me this evening. But if we I see somebody has indicated that I am being heard, and that's good. And so we'll go right away. I'll try to make use of this time before the internet plays a fast one on me again. So we'll be talking about home health care, way forward for health related issues during COVID pandemic. And we all realize that in the preliminaries, the moderator made a beautiful one and was able to do just a head count of people who have come down with it. And so we are realizing that it is very real. COVID is very real. And I followed up one other discussion, and the speaker was saying that we are actually thinking that we'll be shifting from a pandemic to an endemic. COVID, it's like it's here to stay. It's telling us to rethink the narrative. It's telling us that it's about time that we do things differently, because COVID is around and may be around for a while. Therefore, we need to readapt. We need to change the way we see things and the way we do things. If we remain in the way we used to do things, we may just miss the mark. So it will be very important that we talk about healthcare and see what different way we should be able to go about managing our health in this pandemic or endemic, whatever we are deciding on. Next. Okay, now we will realize that COVID-19, there is an easy spread of COVID-19 when people are within close proximity, and this has made so many people to be reluctant to visit hospitals, and the infection rate keeps putting pressure on the available facilities. I heard Kenji, I think, and who was saying that they were able to test as many as thousands of persons and up to 27%. That is, you do the absolute numbers, you realize that that is a very high number, and you can imagine what effect it's having on our hospitals. And because the pressure on our hospitals is high, we also realize that people who go there, especially the non-COVID ones, they are already in a high-risk zone, and it makes it very easy for COVID-19 to be spread in such milieux. And so more and more, because of this, people are not very comfortable going to the hospital for one reason or the other. They will rather prefer probably to stay at home or something. And of course, there are consequences to this. Next. So what are some of the consequences? The consequences is that you have an increased patient count for COVID. The number of patients are on the rise. Some people just picked up COVID probably because they went to the hospital. And so they picked up COVID. And so our statistics will keep on increasing. And of course, because the statistics is increasing, we find out that we have shortages for non-COVID related diseases. You know, at one time there was a lot of information and people being encouraged that if you are sick, you should be able to call and have directives, you know, unless it is exceedingly important, then can you go to the hospital, because there was actually shortages of bed for non-COVID related diseases. It was really an emergency and they had to prioritize these people. The other day I had an opportunity to talk with one of my relatives who said they opened where he is. I think he is in London, and he says that during this COVID period, they opened a hospital just for COVID patients. It was about 4,000 bed capacity, and yet on a daily basis, there was no space. So you can imagine figures and the impacts. And now let's come back home. We already know that take away the COVID, we already have bed shortages. We have a staff that is overwhelmed, is already under plenty of pressure because we have so many patients. So at the end of the day, we find out that the consequences of COVID on our healthcare is really, really significant. Next. 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 Okay. So what now? What now? If we already know that we have an increase in the number of COVID patients and it's not going down anytime soon, we already realize that our capacity is unable to handle the COVID patients, let alone the non-COVID related patients. We need to be able to do something. We need to be able to think out of the box. We need to be able to have a way of handling this that will be, to borrow from the political realm, that will be a win-win for everybody. The patients, especially the non-COVID patients, should also be taken care of. And now, immediately I talk about the non-COVID related patients. What comes to my mind is people who are, having life-limiting illnesses, who need, by the virtue of the fact that they have these diseases, non-communicable diseases, they need to visit the hospital on regular basis. So what happens to them? They are scared of going to the hospital. And yet they need to be in the hospital. They need to be followed up. They need to be checked upon. They need regular health care. So what happens to them? So we are proposing that if we need to take care of these persons, if we need to take care of our aged ones, if we need to take care of persons who have life-limiting illnesses or non-communicable diseases or whatsoever that has come to stay with them, we need to be able to rethink how we are going to deliver healthcare to them. And what we think can be the game changer is home healthcare. Next. Okay, home healthcare is what we are proposing, that we can be able to have a win-win situation. We have these people who they have illnesses that will always warrant that they should be followed up, they should be taken care of, and yet we don't have the space to accommodate them. We don't have the personnel in the hospital to follow them up because they are overwhelmed by what the COVID patients, the pressure that is putting on them. So we are proposing home health care. And next, what we are saying also is that home health care is not a nurse coming to do your laundry, is not a nurse cooking food for you, is not a nurse, because there are so many people who have misinterpreted this issue of home health care, and they think that they need a nanny, but I should just get a nanny who is a nurse. And so they will want to put all of the activities over the nanny and think that, well, being a nurse will just be a plus. That is not home health care. Home health care is a trained nurse administering healthcare to you in the comfort of your home. You can just want to quickly throw back your mind at there's so many things that are being done in the hospital. They will administer medications. They are going to, I will talk in the context of nurses. They will administer medications. They will prevent bed sores. They will take care of your wounds. They will do patient teaching. They will link you up to doctors. If there is an emergency, they will handle it. They are able to pick up the key vitals and liaise you with
It's like we lost her. Hoping that she regained her connection. In the meantime, while we wait that she regains her connection, Mono, you've had the opportunity to send nurses to take care of a loved one in your home. How was that experience like?
Always have had the opportunity to actually both employ a nurse to take care of my mom at home. So this is a very emotional kind of topic to me. Why? Because it's private, but I'm going to share. My mom had a stroke some 3 years back, and what she needed most and what has helped her most has been physical therapy in regaining all her. She had a huge MCA stroke, meaning it was in the middle cerebral artery. It's a huge part of the brain. And she was unable to talk. She was in London when she had this. And while in London, she received state-of-the-art care. She got Actaplace, which she got medications in order to help her with at the time. And she also was not a candidate for mechanical thrombectomy at that time because it was not standard of care in London. And I did talk to the neurologist. My elder sister is also a physician there. So at the time, when we're moving her from London to Cameroon, she could barely talk. She could barely walk. And when we went back home and visited her, she's a nurse by profession. I think a lot of people do know her. She was actually the general supervisor of the General Hospital. So she knows what is happening. She's aware of this. And it became eminent to us that what she needed was more of someone who will be able to understand the medications that she takes, how she takes them, when she has to take them, when she needs care, communicate with us also, and be able to set up her appointments, because she needed to see a neurologist, she needed to see at certain times a cardiologist, she also needed to see a primary care doctor. These are things that are not routinely done in preventive care back home. It was someone who was truly an advocate of her healthcare. I don't know exactly, they say things happen to everyone, but she knew her blood pressure medication, she took them regularly. Then we did get two kinds of care as in Ostensia states. A nurse who is providing, there are several levels of care. So we had people who were taking care of her in terms of more of an aid kind of job which was going on, and they could help her, but she recovered pretty fast. And we also had a nurse who came in and made sure that she had all her medications, made sure that her blood pressure, her sugars, everything was well controlled, and also made sure and took her to appointments. And also made sure that she did not miss any of them, and communicated with us back here in different areas, different places in the world, because she had kids all over. But we're pretty satisfied with what we got. And I think this is a concept that can be very rewarding. And also it can provide employment, it can provide subspecialization. There is community nursing, which is not a concept we don't do much back home in Cameroon, which I think in the past, the Northwest and Southwest was very used to community nursing, where the nurses went back and get vaccinations in their houses and all things like that. But home-based nursing is something we're not used to yet. And I think this is a big concept to decongest our hospitals, to provide better healthcare for anyone who has had loved ones who have been sick or who have had diseases that are not something you can really cure. Like my mom had a stroke. So I would want to give credit to the nurses who provided her with that level of care, to the aides who also helped her out, and to the physical therapists. There is something magic. I know we spoke about stroke once, but right now she's able to walk. No physician actually did that to her. It was not a medical doctor who did that. She's able to walk. She can walk to church. She returned back to her home. She stayed in Yaoundé for like 2 years after the stroke, but she returned back home. She's able to do her activities of daily living and control her instrumental activities of daily living by herself under guidance. So you can see there's a lot of progress. The only problem is her speech, because it did affect the speech area, which is the Broca area in her brain. So Elvis, you put me in the spotlight, but I want to tell you that has been my experience so far. It's something I do respect. And my mom was a nurse, and I've been an advocate from childhood of valorizing nursing care to where it belongs. And you made a very important statement. Who is a nurse in Cameroon is a very difficult thing to define, because there are people who are trained at nursing aides. A nurse, somebody telling you they're a nurse, they trained for 9 months. Another person was trained for for 2 years. Another one was trained for 3 years. The one in Boya was trained for 4 years. And all of them everyone is being put in the same basket in Cameroon, which is it's a big debate for another day. I know today we're talking about this wonderful thing which we're seeing going on in Cameroon. It's a revolution. And I think, Elvis, I would hand over to you from now going forward.
Yeah, thank you so much. As soon as Inocencia regains her connection, let's test to see if she's back.
Yes, I am in. Thank you. Great. And sorry about that. That is Cameroon for us. Okay, can I proceed?
Sure.
Okay, thank you. So I got part of the discussion of Dr. Muno, and that is an interesting one. I love the fact that you see the discussion for nursing is a discussion for another day. Well, I will remind you on that because I'm passionate about that. Now let's continue. Let's go back to our presentation. And next slide, please. We are talking about what exactly it is, and then let's talk about some benefits of home health care. It is convenient. Thank you for your experience with home health care. It just sheds more light, and I think I couldn't have said it any better, because when you give your testimony or your experience of what you have gone through, it makes the picture clearer. So it is convenient, it is cheaper. Some people may want to look at the fee, what you pay, and you say, it's expensive. But what they fail to factor in is the time for you can imagine the queues at the hospital. You can't be able to factor in the worth in francs CFA or dollars or whatever currency you want to use. So it is more convenient when they reach out to you in your home. It is cheaper when they reach out to you. It is definitely safer. We are talking about the context of COVID-19. We discover that in the comfort of your home, the safety there beats no other. If you have to go to the hospital, hospitals are already high risk spaces. And of course, it is very personal. So many people find difficulties in the hospital because they think that issue of my space is being violated. They have to share probably a room with somebody, or they have to, maybe why not even share a healthcare provider with somebody, because you are sharing that healthcare provider at that point in time with somebody, you may not have complete attention from that person. So here are just some of the benefits for home healthcare. And so now, with all of this, I'm going to introduce what we are proposing. I introduce to you Clara. Next. Okay, so we are introducing to you Clara, and Clara is a company that leverages technology to link patients to carers based on patient needs, carer experience, and proximity to one another. With the coming of COVID-19 and all of what we have discussed, we were able to think that, okay, how can we be able to reach the people who are worried about going to the hospital? I also mentioned that there are people with life-limiting illnesses who definitely have to go to the hospital regularly. But because of this fear, most of them, they don't go. And of course, you can be able to understand that it's going to impact on their health, because most of them will not be adherent. Most of them will not be able to pick up on the early signs that is announcing that a complication is coming on, and they may just miss the mark. I share you a little story on how Clara came about. My father is not in his best health for some time now. And while he was sick, there was the issue of we all of us, also the children, are away from him, and we needed to be able to take care of him. My brother Kingsley especially was worried about him, and we were just wondering. He kept asking, and the issue of information, that's one other thing that we need to highlight, was always lacking. Probably he could not explain himself. They would just call, there is one crisis, and we are all over the place. And then to cut the long story short, we got a nurse to be able to take care of him. And of course, the nurse was able to furnish us with information pertaining to his health in real time. And the story actually changed. He is now faring relatively better than he did before. And so I was just wondering, and to myself, if King was so worried about this, then I'm sure there are so many other people in the diaspora with parents back at home, with loved ones back at home, that at the end of the day, they are worried. They don't know what is going on. And maybe they will just have to call them at the nick of time when there is one crisis, because they missed out, you know, on the signs that would have led them to know that, okay, this is a red flag, something needs to be done about it. When you miss out on it, you are called for crisis. And of course, the story you all can be able to relate with if you have a loved one who has been sick. And so that is how Clara was born. And we set up this company, and we are using technology to merge or to match carers who are nurses to patients. It is what I want to say here, though we are having an issue of who is a nurse in Cameroon, it is worth noting that on our platform, all of our nurses are nurses by training, because nurses by training, you must have at least 3 years of training or formal education, nursing education. So we don't have any A-level plus 2 years on our platform. We don't have any 9 months on our platform. We have nurses who are either state registered nurses using the Cameroonian appellation, that is A-level plus 3 years, or we have degree nurses, we have master's degree holders, we have PhD holders in nursing on our platform. So we have nurses on our platform. And because we know that home health care also, there is a lot of autonomy that is involved, and you need to be able to master what you are doing. And if I want to borrow from the experience of Mono, you find out that, you know, I'm happy when he was able to recognize the fact that the entire team did what they did, and there was no direct influence of the physician. So you realize that they could do what they had to do because they had mastered and they had a degree of autonomy to be able to exercise what they knew how to do best. And so we are bridging that gap. We know that there is a lot of online consultations going on, but for care to be given, we need that personal touch. We need the nurse to be there to take the vital signs. We need the nurse to be there to hold your hand and tell you that it will be okay. We need the nurse to be there to teach you what to do, talk about the diabetes, talk about the hypertensives. We need the nurse to be there to be able to do drug reconciliation and all of that. And so that is the beauty that we bring at Clara, offering quality home health care to people who need it. Next. And of course, we are leveraging technology. We have already talked about that. And we will want to also say that at Clara, the services are relatively cheaper. You know, you can visit the benefits that we talked about, home health care. You have all of those benefits if you register with Clara. I think that is what we are also able to innovate and to offer to a Cameroonian population while looking at Africa as a whole, because Cameroon is just the space, a takeoff base, and we are looking at the building the Uber for nurses in Africa. We are thinking of that in a year or 2 or maybe 5 years down the road, each time you think of healthcare, you should be able to think of Clara. You should be able to call up Clara, and they will have nurses that are nearest to you. That is the beautiful thing that Clara has to offer. So yes, home health care is a reality. It has come to stay in Cameroon, and Clara is there to accompany you and accompany your loved ones, even as COVID threatens their going to the hospital frequently. Thank you very much. I think that is where I round up my presentation, and I'm open for questions. Thank you.
Thank you very much. And permit me co-moderate with my daughter. So this is really exciting. And I must say that you'll be receiving tons and tons of questions now that I'm opening the forum for questions and answers now. And people will be asking questions to you. The first question is, I'm going to initiate it and then give it to the moderators before we give it back to the audience. Let's talk about payment. How I know when you were establishing Clara, some of the thoughts in your mind was how will it help those in the diaspora to take care of their loved ones back home? So take, for example, I want a nurse to go take care of a patient in my home and I want to pay from here. How accessible is your payment platform? That's my first question. And after that, Brian, you can take it from me.
Okay, thank you very much. For now, we have two payment platform. We are actually using PayPal and Flutterwave. Those are the options that we have. So it's easy for us to be able to work around it. And yes, I think it's easy, but people who have challenges using that, we have an account and you can be able to use some other means to be able to send it into our account. Thank you. And in Cameroon, those who are in Cameroon, we use what we regularly call Momo, the mobile money. Yes, so that is easily available to everyone. So in Cameroon, it's easy for us to be able to use that. So those are the things, the options that we have. Thank you.
Thanks in a sense for this really brilliant presentation, and really thanks for this innovative idea. I think the importance of really having home care services has been intensified with the COVID-19 pandemic. Initially, trying to not have people fill up the hospitals, and at the beginning of the pandemic, I think it was such a huge challenge, because we're trying to ensure we do not have people coming together and congregating together. That's where those are where we find the most vulnerable groups, for example, in congregate living facilities, in assisted living facilities, in long-term care facilities. And really appreciate you for really coming up with this really great idea. And I really hope that this is going to span through. I wanted to know more about this. How have you dealt with retaining talented, retaining skilled nurses throughout, and having them stay? And just want to really understand better how how the recruitment and retention of the nurses stay, and if you're working with physicians, and how does that work with, is it with telemedicine, and I saw you mentioned that you collect blood samples as well, or you could collect samples from patients. Just really want to know about how that works. And also, if you could talk a little bit about the confidentiality of the patient's records as well, and what kind of system you have in place for that.
Okay, thank you very much, Brian, for your question. Maybe I begin from the first one. The nurses are actually free to choose to come in. We have been able to get them by word of mouth. That is, one person tells the other about the platform and they choose to come in. But we let them know that it is for nurses. And how do we control that it is a nurse and not a nurse assistant and not a nurse aide? We expect that when you sign up, you send in your documents. So on our platform, we have all of their documents to attest to the fact that they have A-level plus at least 3 years of training. That's the first thing. The other thing also is that most of them are already workers, and well, they will plan their schedules around their work, or they will have in their CV that they will send to us. It will notify where they work, and so if we need to be able to control on that, well, it's good and fine. But as I said, they need to send us information attesting to the fact that they are nurses. We have an issue with a council in Cameroon, but we have a nursing order. And so we also expect that they should be able to show proof that they are members of the nursing order. Well, we have a little challenge there, but people who are signed up, they show proof that they are nurses by training. They show proof, if they are working somewhere, they need to be able to show proof that they are working there, and they need to be able to show proof of being registered to the nursing order in Cameroon. And for the confidentiality of information that is being generated, the information or patients are anonymized. Even if you click to our platform, it will be difficult to say this is patient Mary or patient John or patient. So we have been able to code all of them, and the code is under lock and key. So we are the ones who can be able to decode that. So we want to think that to the best of our ability, the patients are anonymized or coded. And so you will simply see codes and you will not see any patient's name. And for the nurses, they also are reminded of the ethics of confidentiality, and they sign a contract that states that any breach of confidentiality, that is any information that they get under the canopy of Clara, if it is gotten anywhere else and it is linked back to them, of course, they will be kicked out of the platform. So those are some of the things that we have been able to do. I think there was one other question on sample collection. Yes. Well, for sample collection, if we have a patient who needs samples to be collected because we have gotten in contact with doctors. You asked another one about doctors on the platform. Yes, we have some doctors that we can be able to link our patients to when need be, but most often, I keep highlighting the fact that most of the people who benefit from it are people who already have life-limiting illnesses, and most of those people have attending physicians. And so some of them, we just get back to their physicians, and if there is any test that needs to be done, we liaise with a lab, and we can get a phlebotomist to come collect draw the samples and get to the lab. And of course, within 24 hours, you are able to get your results. So I think, if I'm not mistaken, I've tried to address all of your questions. Thank you very much.
Yeah, thanks.
Great. And so, Therese, any question from your end?
Well, the only question that came into my mind was communication. So in Cameroon, I know communication is a huge problem on how nurses communicate with their patients and all that. So do you train your nurses on how to communicate with the patient? Because some of these patients might be patients with diseases that make them do things or say things. Like, do you train them on how to talk to patients, what to say or what not to say? Like, just that.
Okay, thank you very much for your question. That's a beautiful one.
Cecilia, just to add, so that I don't, sorry to interrupt, just to add to that question, so you can just take the opportunity to answer. How much of training is given to the nurses when they sign up, in addition to the training on communication?
Okay, all right. Thank you very much. It's the first thing that we have to realize. I just wanted to first of all pick up on the comments that she said about nurses having a problem with communication. I think I've already said I'm passionate about this nursing thing because I am a nurse and I have been able to own over 20 years of that experience. So I want to say some of the things that you say, I have an understanding of what you're saying. But unfortunately, because nurses or people who are nurses is not clearly defined in a setting. You have a nurse aide who pass for a nurse assistant who pass for a nurse. And so at the end of the day, whoever does trash, it will always be a nurse, because if you're not a doctor, then you're a nurse. That's the first thing. But then for the issue of communication, we provide training based on the needs we have identified from the nurse. When we onboard a patient, and probably there is a particular need that the nurse has brought up, we are able to provide training related to that. But on our platform also, we have regular trainings for the nurses. That is another thing that we have. And then we are able to get feedback from the carers, from the patients. So if your communication is problematic, or the patient has a problem with the way you interact with him or her, because we have feedback from the patients or from the person who is in the house at the time, because most of our patients are aged. And so when you are taking care of them, they may indicate that I want this son of mine to be around, I want this daughter of mine to be around. And so if at the end of the day we have feedback from them that you were not in your best behavior, then you're going to have a warning from us. And for those who have brilliant feedback, we have incentives for them. So for the training on communication, if there is a need for that, we actually address that. And then we have slots, slots for training slots. And we expect, even if you look at our contracts that we sign with them, we expect that they should be able to go through those training. We want to differentiate ourselves from what regularly goes on, that once you have a job, you forget about learning. No, to us, once you sign up with us, know that it is a continuous learning process, because we expect that you should be able to go through a series of training modules by the end of the day. So we are encouraging continuous professional development even on our platform. I don't know whether that answers your question. Thank you.
Yeah, that's wonderful, and I'm really happy that you think about continuous education. And the next question before, and I want to take James, whose hands have been up for a while. James.
Hi.
Okay.
Hi. Can you hear me?
Yes.
Yes. Good afternoon. Good evening. My name is actually not James, and Innocencia sent me the link, so I just clicked on, and it pops up as James. So I truly do not have a question. I just want to piggyback on what Innocencia said before, questions can trickle in. Like I said, my name is Mirabel. I reside in New York, upstate, and I am proud to say that I'm Innocencia's classmate, Pioneer UBA Nursing, first batch, and we went through a rigorous program. It was tough, and I can see her passion. It's amazing. I also would like to say that thanks to the foundation that we got in Boya, I am a family nurse practitioner in upstate, and the CEO and founder of LNP in Family Health, which is a community-based primary care. I do home visits. I'm a primary care provider to home-based patients. I have primary care patients. I have patients in assisted livings, and I do IV hydration and wellness also. And to add on to that, I am a beneficiary of Clara. My father is a client of Clara. In our first batch forum, Innocencia had put this when she started a few months ago, and I reached out to her and asked her to tell me a little more about her vision, and I absolutely love it. My thought to sign my father on, he's 78 years old, wasn't because of COVID, really. It was because her vision gave me a lot of peace of mind. I saw in her many things that I'm doing here for my patients, and I know what I'm doing for my patients here are the right things that I'm doing for them. And I knew that the gap and the sleepless nights that I had with my father, thinking about my dad, who is 78 years old. He's got hypertension, he's got glaucoma, he's got hyperlipidemia, you name it. He's got all those chronic comorbidities that an elderly person is going to have. And my father is an English teacher, so he doesn't know any better, you know? So getting Clara on board to see my father was the best decision I have made in a very long time, besides going to nursing school at University of Buea. It's also the most rewarding and cost-effective health decision I have made for my parent back in Cameroon. Clara sees my father twice a week based on the program that I choose. My father just went through a glaucoma surgery and they saw him post-op and followed up. I get reports every 2 weeks after a visit, encrypted, great nursing-based reports. I am so happy, Innocencia, I haven't told you this, but I am proud to be a beneficiary of this program, and I'm hoping that we can all join and help support this wonderful, amazing initiative that will only cost us maybe $40 a month or $60 a month to help give us the peace that we need with our loved ones back home. I also hope that we can help support her so that she can spread this wonderful initiative in many different areas in Cameroon so that the healthcare system will benefit and so will our loved ones, because I believe that improving health one patient at a time and one visit at a time with compassion is what we are all about as nurses. So I'm also going to say this. Innocencia did not ask me to talk here today. She didn't even know I was going to do it. And on that note, I'm done. Thank you all.
Thank you so much, Mirabel. Thank you, and glad to know you're in New York. Hopefully we're going to connect. And it's so great. We all are saying this is a great innovation. I wish I knew about Clara some few months ago. I was ready to pay more than $120 to $200 for someone to take care of my father-in-law. I was able to get a nurse. Some of them just sign up and will not show up. So it was really a painful situation. Unfortunately, I lost him. But thank God many people are getting to know about Clara. Dr. Dieter Ivor is having a question, and next to him will be Dr. Agbo. So Ivor, the floor is yours.
Yeah, thank you so much, Elvis. I want to start by really, first of all, appreciating the great work that our speaker today are doing in Cameroon. Following that, I have some questions. Again, these questions are not intended to discourage them or to be negative about these efforts, but I really want to put it in a more bigger picture in the context of care in a developing setting like that in Cameroon. So if we look at the current health picture or setup in Cameroon, we are dealing with a country where we have very limited health personnel. The ratio of healthcare provider to patient is very huge. I mean, we're talking about 10,000 patients per healthcare provider. The setup of home healthcare, the way I've always perceived this, it seems to fit in the context where we almost say we have enough in the hospitals where we can then move into a one-to-one setting. What by that I mean, we have a structure like a hospital where we have one nurse having to attend to 20 patients. If we now take, in our setting, take this one nurse to now go to home and address the issue of 1 or 2 people, what happens to the other 18? So when I look at this from a bigger picture in terms of where we are where we are in our healthcare setup, I wonder whether this service is primarily, in quotes, a luxury. And by luxury, I mean it's restricted to those that the haves and the have not will probably not be able to gain access. And by this service working, do we take away from the main hospitals, the institutions where several people usually go to be attended to by this one personnel, and direct to one person, and then overall the general society suffers? So that would be, I would like the speaker to address how this fits into our system. In the developed world, it's easy to understand, but in the developing set, I don't know if it fits very well. So I would like the speaker to comment on that.
Thank you very much. Your concern is genuine. Your concern is genuine. And before I dive right to giving a response to you, I just want to appreciate Mirabel for her wonderful feedback. As she said that she hasn't told me this before, and I'm getting it, so I'm so excited about the feedback that she has given. And Mirabel, thank you for your feedback. And it is beautiful to know that you can be able to sleep and continue with the hustling. We know the hustle is real. Okay, now back to your question. We are not taking nurses away from the system. If for anything, we are adding, and we are adding to lessen the burden of the system. By doing what? Remember I said that we are tapping into the free time of the nurses. So it's not like if you're a nurse, you should leave your work and come work with Clara. No, if you're a nurse, we all know that nurses have shifts. They have off days. And so if you are a nurse, we are simply working around your free time. Like the Mirabel just shared her experience. The nurse who works with her is a nurse working in a regional hospital. And because she works there, she has not stopped working. She is still working there. But then she programs her visit, and we are able to get to the understanding that, okay, you're free at this time. We get in touch with the patient, and the time is convenient for the patient. And so we are able to say, okay, now this visit is going to happen at this time. And of course, based on that, the nurses can be able to make multiple visits. So we are not taking anything away from the hospitals. To me, I think for anything we are adding, or we are adding value to what they are doing, and taking away some of the burden, from there. And of course, as we progress and we grow our platform, we'll be able to provide health records, which is something that we don't have, and it will definitely be an addition. Sorry that I always have to go back to Mirabel. I have already mentioned that this was not pre-planned, and I'm also getting the feedback just as she gave it. But she has her records, her health, her father's health records that is given to her. What we have in view is that in the long run, when a patient, if they have to go to the hospital, you can be able to click, the doctor that is seeing this patient, you can be able to click onto our platform, and you get a record of that patient. That is if the patient consents. But for now, the attending physician has information or pertaining to what the patient is going through at any point T. And to me, with all of this, I think it's an addition. We are helping the system. We are not taking away anything from the system. Thank you very much.
Yes, and as I said, just to add to that, maybe to push the question a little bit further, there is the pull and push factor. And when it comes to the pull factor, you have basically little control over it. If you pay more to a nurse, and the nurse knows that on Clara, I'm going to earn more, do you have any control to know whether the nurse is abandoning some assigned duty to Clara?
Okay.
Do you have control over that decision?
Anyway, we are just helping them to make extra money. They stay at their job. They stay at their job, and they make extra money. Extra money is always good. But you are very right in your inputs. You are very right. But we just help them to walk around their schedule. We don't take them away from.
But there is something I wanted to help you in that response to Dr. Dita. The error is to think that there is a shortage of nurses in Cameroon. There is no shortage of nurses in Cameroon. The reason why nurses are absent in the hospital facilities is the refusal of government to employ at mass. not the shortage of trained nurses. I think if there is a profession in Cameroon that has people that have been trained and are floating, it is the nursing profession. That is why you have clinics all over the neighborhoods, because these nurses are looking for a way to make earnings. If you go to Bamenda alone, we have more than 5 training nursing schools that are training nurses to be state registered nurses. You go to Yaoundé, there are more than 25 of them. Nurses are graduating every day from this school, but they are not being recruited by government, which government is 80% the highest provider of healthcare in Cameroon. If government does not recruit, the private sector can only take 20%. So I think the problem of nurses in Cameroon is lack of uptake of trained nurses, not absence of nurses or shortage of nurses.
Thank you very much.
Just so she completely addresses the points that I raised. What do you make of the point? Is this a service for the haves and the have-nots do not have access to? How do you, if somebody came and needed this service and doesn't have the means, what do you do?
That now it's a very interesting one. If you came and you did not have the money, definitely I would not be able to displace a nurse from their home to come to your home when the nurse is unable to get taxi money, or even if the person, anyway, what we want to do is the patients are always a walking distance away. But the nurse definitely will know that if I have to put in some extra hours working on this person, I should be able to get some extra money. We are yet to grow to reach that point that maybe we'll have to say that Clara is going to cover for those who don't have. For now, our rates are fair enough. And if you need it, you should be able to raise that rate that we think that is fair. Unfortunately, if you are unable to raise that rate, then we will not be able to help you at this point in time. We are still growing and we cannot strangulate the baby before it's born. Thank you.
Thank you so much, Innocencia, for your response. And thank you so much, Dr. Dita, for bringing that very important point. The next person is Dr. Agbo. And before Dr. Agbo, I think we had our own Alison. Alison, tune in, I don't know.
Hi, Elvis. Hi, everyone. It's always a pleasure to see you all, and Happy New Year. Innocencia, thank you so much for this very interesting conversation. I'm sorry I had to join in late because of some major competing priorities, but I did follow the key parts of your presentation, and I'm burning with questions because I think this is an amazing initiative which a lot of people can benefit from. And yes, kudos to you and your team for the amazing work you're doing. Elvis, over to you.
Thank you so much.
Thank you very much.
Everybody's looking beautiful and handsome this 2022, and I'm so happy to see you smiling, and you always bring a lot of energy in the house. Good to see you, Alison, and welcome. Over to Dr. Agbo, sorry.
Thank you, Elvis. Yeah, I like it when you crack this joke, so thank you for that, and Happy New Year to everyone. So before I get to my question, which is a little bit not completely health related, but it has some health importance, I would like to say that I was privileged to have sat in the same class with this fantastic lady who spoke. She was first year nursing, I was first year medical lab, so we spent our 4 years together causing troubles to each other. So I'm very, very pleased with her initiative, and I sincerely applaud her and support her, and would like to support her in every means, on every way possible. So congratulations, Innocencia, for this fantastic initiative, and keep up. So now to my question, or maybe before I even ask my question, I'll probably just like to comment on something that Dr. Dita asked about healthcare, about this initiative probably being for the haves. I would probably just want to say that I think that's what healthcare is in Cameroon. So people who go to the hospital and they don't have money, most of them don't get attended. Everyone will not agree, but I think that is a real issue in Cameroon now, and that is the truth about it. But to my question, Innocencia, I know you are based in the Northwest Province. And I know probably in the next couple of months, then as time goes on, your initiative will spread across the country with all the with how good I think it's going to be. But my question is, in the Northwest Province now, there is we know there's an ongoing war, and you have these nurses that you have to send to the field. How do you intend to navigate the security issues? I mean, like the security of both the nurses as well as the security of your patients.
Thank you very much. And Dr. Agwo, when they were saying Dr. Agwo, I was trying to figure out, is it the Agwo that I know? I'm excited to see you. Thank you very much. I'm happy to see that most of my classmates or some of my classmates are here, and hearing a kudos from them makes me really happy, and I'm elated about it. That comes to tell us that after all the training that we get from Cameroon, it's good. And just like both of them have been able to say, we were trained here in the University of Buea, and I think so far the outcome is there to attest that the training or the foundation that they gave us was a good one. Thank you very much, Dr. Agbo. I'm happy to see your face again after so many years. Okay, now back to your question, the issue of security. Yes, it is something you can't talk about Cameroon now without talking about the issue of security or insecurity. Now, the first thing is we said that we are leveraging technology to match patients to carers based on patient needs, carers' experience, and their proximity to one another. Most of the carers are just walking distance away from their patients. So that already limits their exposure to insecurity. At least as bad as the country is, we still are able to move around our neighborhood. And because we are able to move around our neighborhood, most of the nurses will consider that this is just one work that I needed to make in the neighborhood. So that's one thing that works for us. And the other thing also, we know that we cannot deny the issue of insecurity. We cannot deny what is going on. And unfortunately, we are not the government and we don't have so much to say about it. But what we do to ensure that our nurses are safe first is to ensure that their proximity between patient and carer is really small. Secondly, is to be able to understand the times. We have had times where a visit has to take place on a Monday. We all know what Monday stands for in this English-speaking side. And we will call the patient and say, for security reasons, this nurse cannot come to your place. So we try as much as possible to keep away the Mondays, because we know that Mondays is, anybody who lives in the Northwest and Southwest knows that Monday is a stay-in day. So if you want to go out, it should be on your accounts, not on Clara's account. So we try not to make visits on Mondays. So I think those are some of the things that we try to do to ensure that our nurses are safe within this jurisdiction. And the other thing that maybe I just want to chip in before I take my leave, or it's the fact that well, our nurses are not actually only in Buea, in Bamenda, and all of that. We have nurses that span all over Cameroon. So probably the issue of security may not be very real to the people who are away from the English speaking side of the country. Thank you very much.
Yeah, thanks a lot for that response. And I'm happy to know that it's spread across the country.
Yes.
Congrats again.
So Alison.
Thank you, Elvis. And with regards to the issue of security, I was just thinking that there have been instances where healthcare providers have actually been flogged in the hospital settings by patient caregivers, maybe because they felt that the quality of care they got was not good enough, or the verdict they got was not what they wanted to hear. What would happen in a scenario where a Clara team member is actually molested, for example, in a patient's home? I'm just thinking, like, now we have the issue of the national security or regional security, but what could possibly go wrong if, as a healthcare provider, a nurse goes to a patient's home and things don't go too well for them there? That's like one question I had. And the second one, if I may, with regards to how to homogenize the quality of care, I know you've mentioned training that is given at the onboarding process and potentially in the future, continual medical education as a way to ensure that the team members are, like, the quality of care is kind of homogeneous. Do you provide medical equipment to Clara team members just to ensure that, patient A and patient B have access to similar quality of care, or do these nurses have to bring their own equipment to do the job? Thank you, Elvis.
That's a very good question, Alison. Thank you so much for bringing it up. Over to you, Innocent.
Okay, thank you very much. The first question, a scenario if a nurse is molested in a patient's home. Well, for now we have not had it, but so hypothetically, if that happens, it's a crime, and I think we are going to follow the criminal procedure. As I said, we have not had a situation, and that is a best bet. That is, if the person reports, because definitely the person is going to report, we are definitely going to follow, because the patient also, we have the location of the patient, we have the address of the patient, and definitely we have the contact of the angel. The angel is the person who pays, or the person who signs up. So we have all of this, and we can be able to get back to the patient. We are going to make a complaint to the angel, and if nothing is being done, definitely we need to be able to follow up as a criminal procedure, because take away the fact that the person was your healthcare provider, I think it's a criminal act, or is a violation of human rights for you to assault somebody. So I think we are going to address it in that manner. But as I said, so far we have not had any situation like that. And
as a measure,
yeah.
just sorry to interrupt you, but as a measure to just mitigate such a thing or prevent it from happening, do you have a bill of right which you hand to your patients, just so they know their rights and responsibilities and what is expected of them? Because sometimes it could help them to also know that anything that happens to a nurse while in their home, they are responsible. So on your platform, can we find a copy of a bill of rights that your patients actually go through before they accept home visits?
On the platform, it's not there, but in our contracting, we try to capture that there. Great. And we try as much as possible to make them, even in a discussion, to understand that while the nurse or the carer is there, anything that happens to them, they are held responsible. So we have this mutual respect, in as much as we make the nurses to know that they have the right to offer professional care to these persons. We also make the patients to know that the safety of that nurse at that point in time in their home, it's definitely something that they should not take for granted. So we have enjoyed mutual respect from our patients and nurses so far, and we are hoping that even as we grow, we will continue to articulate it well, so that we all are on the same platform. And the other question that Alison asked, it was on quality of care, if I'm not mistaken. I've forgotten the question.
You provide some equipment, baseline equipment.
Yes. Well, for now, we really don't provide equipment for them, because we take the nurse like a farmer, and if a farmer has to go to the farmer needs to go alongside with his hoe, with the cutlass, and so on and so forth. So there are basic things that we expect the nurses to have, and we actually find out during the onboarding process. That's before we assign a patient to you. Do you have your functional blood pressure machine? Do you have your thermometer? Thermometer, it's not, they don't even share it. So at least the functional blood pressure machine, they should be able to have. And there are other things that we encourage. For example, we have a client that is diabetic. And on the first visit, because we had that information, the carer actually went along with the glucometer. but you will bear with me that it will be difficult for everybody to possess a glucometer. So we're able to get back to the angel and said, because we want to closely follow up your father, we think that your father should be able to have a glucometer. And the angel responded, and that was actually done. So the father has a glucometer in the house, and it eases the follow-up. So we really don't supply equipment to our carers or to our nurses, because we expect that at least the basic minimum they should be able to have to assist them. It's just like when you're going to the hospital or something, or you are back at home and your mother is sick, you use your blood pressure machine to take the blood pressure. So we don't give them equipment, but we ensure that they have the basic to be able to carry out the visit. Thank you very much.
Yeah, thank you so much for that response. I know all these responses are helping you to think also progressively as you continue to develop this platform and innovate. And I was still going forward, there are mechanisms you can put in place to homogenize your resources and equipment, just so you are confident that the blood pressure that a home nurse is on Clara is taken from or is checking from a patient's home. You are sure, as the founder and CEO of Clara, that blood pressure is correct. And you can do this by standardizing your own particular kinds of blood pressure equipment that you think is user-friendly and that is easy to use and that is reliable. Once you've had that, you can provide a kind of discounting system where maybe you say, for each nurse that signs up, we are going to provide you with this blood pressure machine, but we are going to discount it from your payment. And if you sign out from this program, you own the blood pressure machine because we would have discounted it from your payment already. I mean, there are so many ways you can go about it, but I think it is something worth thinking, because you mentioned that just like a farmer, a nurse should have a hoe, but I think that's not the reality, because a nurse who works in the hospital uses the hospital blood pressure machine and has no obligation to own a blood pressure machine. But of course, if the nurse decides to sign up for home visit, the nurse has an obligation to own a blood pressure machine. But as to what kind of blood pressure machine or what type, or the quality of the one that the nurse has, you might want to have control over that by just having a system in future. These are not things to be done now, but in future you can think about systems you can put in place for the basic things, just to make sure that there is some quality control and quality assurance process in Clara. This is really great suggestions too that I think are coming in. Thanks so much. I see Muno's hands.
Thank you very much. Thank you very much.
Muno?
Oh, thank you, Elvis. And I have both questions and some suggestions also. Like, my first question to Cynthia is, has she thought about expanding it to a point? I know we're verifying nurses, but there are certain services that are not carried out by nurses, and I don't want nurses to carry them out, but they are essential. Meaning they're also essential for our loved ones to have those services when they're unable to have them, which may include nursing aid services, if we're able to really define it that way, and be able to get people who would help with activities of daily living. Is there a platform that you're thinking maybe in the future after where this kind of services can be provided by other level of nursing care, which is going to help also provide these services, like it's done in a lot of places in Europe and in the US, where there's a difference between a nurse and a nurse aide, and they provide different levels of care. And there are certain levels of care which can be very helpful for these patients, but cannot be provided by the nurses. And it's actually going to really provide a lot of satisfaction to these families. Are you thinking about something like that? Also, are you thinking about maybe getting to the point where we do have midwife training in Cameroon? I know that's going to be a level of advanced care, and also there is also legal implications of women getting to do deliveries at home, which is provided by a certified midwife who can do that at home. Because now I know Cameroon stopped training midwives for over 20 years. They resumed about 10 years ago. and they're trying to catch up. And I think it's a field too that your platform can advocate for other platforms. And I don't know if it's something you may want to think about in integrating it in the future as you grow big and as you get into the system and understand really how things are done. And also going into training, there's something I observed in Cameroon, which I just observed a video of a loved one I know who had a gunshot. And there is really little training both in the public and even in the hospital. And it's something I've discussed with Elvis a lot about training people on basic life support. And these are things I really want you to, if you're not integrating it yet, to add to it. I think I'm seeing this as a platform which I want to, I've known you for quite a while. And I think it's something that integrating training, you can make a difference by once you get these nurses into your team, we use it as a springboard where we can train them on the basic life support, advanced cardiovascular life support, pediatric life support, which is not really done routinely in our setting. I grew up as a physician back home, trained back home, but those are things I was not really, the young generation may have been trained, but as I was not really introduced into this, like to see how important this is. And you get to see people die when basic things could have been done to save their lives. And if an emergency occurs, your nurses will be able to teach, or they'll be able to practice and change the way we look at how things are done. So those were just some of my things, were more about suggestions. And truly, every initiative back home which is going to improve the life of patients, I really am an advocate of it, which is going to also valorize the healthcare system. I'm an advocate of it. A friend made a joke last week to me that very soon there'll be more doctors in Cameroon than the number Cameroon needs. Truly, because if we're turning out, every region has a medical school that trains 200 doctors, you can imagine. And as Elvis said, every region has about 6 or 7 nursing schools that train nurses. The problem is recruiting them. Maybe we may be training nurses and doctors for the whole region. But now we need to learn to valorize the people we train.
Yeah.
Because if we need to learn to valorize, there's one other thing in nursing. I've been very particular about nursing. A nurse who goes to nursing and studies for 4 years, where does the government put them in terms of classification in the service even? You get to see that that's even a problem, even in integration and how they are paid. These are all things that go into the profession of nursing that Elvis said we're going to talk about it some other day. But these are just reflections I'm giving concerning how to improve the platform. But I want to thank you really for what you're doing. Elvis, thank you.
Okay, thank you very, very much. I hope I'm going to remember all of your questions. Let me begin from the first one that you made. You talked about, was it deliveries at home?
No, my first one was, are you thinking of integrating both nursing aides later on into the program, because they provide and deliver, and also midwives, maybe specialized nurses, midwifery.
Okay. Thank you very much. Well, for now, we are planning. Announcements will be made in the future. So for now, we really cannot deny or confirm, but we are looking at the possibility of doing that, because yours truly, we have had a couple of persons who have wanted to sign up, sorry about that, who have wanted to sign up, but clearly they needed the services of nurse aides to help with activities of daily living. So we are still racking our brains around it and seeing how feasible this will be. So for now, I will not be able to confirm or deny that. And as for deliveries at home, the risk exposures are really too high, and I don't think we want to go down that road now. It's true that the government has resumed training midwives and all of that, but for the aspect of deliveries, we may not want to go down that route. For something maybe following up the pregnant woman, okay, we can consider that and include it in our platform. But for deliveries, we think the risk involved are too high, and we will not want to go down that route. And now for your last question on training and the training modules, the one around advanced life care. Well, we have mandatory courses that we offer to them, and truly we include basic life support and what they want to they will have to know in cases that they have an emergency and the first aid that they will have to do. But it will be interesting that what you're talking about, if you have time to spare, we will gladly want to include it in our mandatory courses and then have you deliver some of the courses for us. That will be beautiful. Thank you very much. I think that is what I have as responses to your question.
Yeah, you always have my support anytime. So that's
Thank
a promise. And also to add,
I'll get back to you on that.
Yeah, and also to add is that we can, as a group, as Dr. Ndita said, Dr. Ivor, healthcare should not only be for the rich, and there are other organizations that you can liaison with who can be able to sponsor certain cases that people who cannot afford. I'm not also in the opinion that nurses should not be paid for their services, but I'm also of the opinion that we could also outsource and get resources from other organizations and NGOs that can help people who are unable to afford and actually pay you for your services while actually networking with other organizations. So
that would be beautiful. That really will be beautiful.
Thank you.
Thank you. Thank you very much.
That would be beautiful, considering that there is news that the Minister of Public Health recently released some 26 prisoners from the hospital in Douala. These are people who were treated and held hostage because they could not pay their bills. So payment for health out of pocket in Cameroon, and so they have not those who suffer. So good thing to suggest if people can create some solidarity fund on your platform where some people who desperately need your service and cannot pay can benefit from, that will be amazing. We are almost coming to the end of this platform, and before we give Innocencia some time to sip a glass of water, let me hand it to Alison, who knows best how to check the temperature in the house. Alison?
Thank you, Elvis. Always so exciting. I see some new names. Not so much about faces. It's always good to see faces so we can put the name to the face and the voice. So I'm going to poke on people randomly, and please do not hate us for this. And it's always fine if you absolutely decide to decline, but we would love to get to hear your voice, hear your thoughts on and any last remarks that you might have for our great speaker for today. So I'm going to call on Wasu Nchandone. Hi, Wasu. Wasu, are you with us, or you just don't want us to bug you today? Maybe we could try another time. Okay, maybe Wasu might not be able to unmute themselves at this time, so I'm going to call on Ngochembo. Hi, Ngochembo. Hi, can you please unmute yourself just so we can put a voice to the face and the name?
Okay, good evening.
Good to have you. Welcome. Where are you joining us from, and what do you think about today's session?
Okay, I'm joining you guys from Cameroon, precisely from Douala. So I got the link in a school group by one of our lecturers, and I thought it wise to be part of the program. Actually, I'm a BSc student in nursing, and I think from everything I've heard today, I've learned a lot, and even coming to know about Kara, that was something I've never heard of. So I'm very happy because I think even after this, I will take the information to some of my classmates, and even I can also benefit from it. Yeah, thank you.
Thank you so much. I'm excited to hear that you're joining from Douala and that you're a student. You know, it's always good to see people who are upcoming in the field. And I guess this is your first time at the town hall.
Yes, madam.
Okay, maybe for you and other people who've joined us today for the first time, this town hall actually holds every fortnight, so every 2 weeks. And it's, as you can see, it's always online because we have people joining from all over the world. And we will be glad to have you join us in subsequent sessions, because similar to this session that was led by Innocencia today, we do discuss a lot of very interesting healthcare topics. So let your friends know that everyone is welcome. It's very non-hierarchical. You can see everybody's laid back. It's a great forum to discuss, to learn, to meet people, to network. And you're always welcome to come back. And please feel free to hit any of us at any time if you even have a topic you want to talk about. Okay.
Okay, thanks very much, Madam Alison.
Thank you for joining, Bochembo. We also have Kingsley Kuala in the house. Hi, Kingsley.
Hi, thank you very much for picking on me. I'm not sure how I can contribute. I'm not a medical professional. I am very familiar with what Innocencia is doing because she's my sister. And as she indicated before, I'd always had issues with knowing what is going on with my father. And so when she started this, I was, all very excited and fully supportive of her. So I'm not sure how else I can contribute.
Oh, this is amazing. Sibling support. Thank you for joining us, Kingsley. She did mention you at some point as being one of the main people who gave her the ideas to even start up this initiative. And just a heads up, someone just hinted me on the back that, you might not be a medical doctor, but that you're a scientist. And we do work closely and leverage the expertise of people who are not just medical doctors. We leverage the expertise of engineers. We leverage the expertise of people who are in IT, administration. So please, this is not purely a platform for medical doctors. It's not purely a platform for healthcare providers. It's a platform for people who in one way or the other do work that touches on healthcare and who come together to brainstorm on how things can be made better. As an engineer, we might decide and say, Kingsley, we're trying to just ramp up the whole process of tracking the nurses who work with us at Kuala and at Carla, and we could use your input. And yeah, now we will loop you in. So now we know that we have Kingsley in the house and he's just a call away. If we try to reach you directly and it's impossible, we would call Innocencia and be like, please help us get Kingsley, we need some help. It was so good to have you join us, Kingsley. Thank you so much and Happy New Year 2022.
Thank you very much for having me. If I may, this is to Dr. Muno. I call him Pado because, basically we are brothers. We grew up together in the same neighborhood. And so most of the doctors on here, I know them personally. I just want to say that you guys are doing a brilliant job. It's the first time I'm coming to one of these sessions. And, the questions that have come in, the contributions that have been made, the feedback that is coming in, the support that you're giving to the younger ones, brilliant, fantastic. Kudos to all of you and thumbs up. Cheers.
Thank you so much, Kingsley. Dr. Muno, those compliments, I hope as a chairman, you've noted them. Nyeju Francis, that's going to be the last person I will be calling on for today. Then I would hand it back to Elvis. Nyeju Françoise. Bonsoir, Françoise.
Bonsoir.
Comment allez-vous? Comment vous sentez-vous ce soir?
Ça va, I will probably speak in English and
Thank you for saving me. My French is horrible. Can you maybe just tell us where you're calling in from and how you found today's session? Just introduce yourself.
Well, my name is Ninjo Françoise and I'm calling from Yaoundé and I'm in the nursing profession and I've been receiving this information about the Cameroon Town Hall, but I've really never had time to assist. But when I saw Innocencia, I said, okay, let me look at it. We've had to work together sometime in Yaoundé and we flocked together in some professional issues and I'm glad to see what she's doing and it's quite interesting. I would just want to let her give some comments as regard if she has a collaboration with the Ministry of Health in doing what she's doing. That would be very interesting so that she's safe on the field as she's doing the work. And I use this opportunity to say that I'm doing a similar work, but more of community-based. Like now I have a sickle cell project I'm taking into the community where we do home care with the community health workers, and we are trying to stream it into other pathologies, but it's more of community based, and we use the community health workers to do home visits for patients. We realize that sometimes in the community it's quite difficult for them to get to town to consult the doctors, so they keep postponing and postponing, and the disease keep increasing. And so I'm glad to see what she's doing, and kudos to your team. Probably maybe I will soon be one of your speaker. Though I don't know how to reach you people, but I think I have a lot to share, and it's exciting to be here. And I really say kudos to her, to what she's doing. Like, and the many comments you've put here, I just pray she integrates it, because they are quite useful suggestions that can make her organization grow. Thank you. Well done, Innocencia.
This is beautiful. Thank you, Francoise.
Francoise. Thank you. Glad to see you, Francoise, and I'm happy that you were able to log in. Thank you.
Maybe, you know, this is one of the beauties of the town hall, is that people get to realize, to identify partners and collaborators that they should be working with. So Francoise, I'm hoping that you and Innocencia have been able to already exchange your contacts at the back. But if you haven't been able to do so, please reach out to any of us at the town hall, either Elvis, Muno, Therese, or Brian, or Christelle, or myself, so we can always, you know, liaise you and Innocencia. And that is going to be it from my part. Elvis, back to you.
Thank you, Alison. Thank you, as always, for electrifying the session with checking temperature in the house. That was so wonderful. And I'll be taking the last round with all the moderators before we come to the closure of this event. And I'll start with Brian. Brian, some last words from you.
I think it was a really great session. Thanks a lot, Innocencia, for joining us, and really wish you all the best with this project in Cameroon. Thanks a lot. Bye.
Great. And Theresia?
I also think it's a great one, and I'll have to thank Innocencia. This is a good initiative. We just hope it's gonna grow and grow and grow, and you're gonna get more partners, and it's gonna go viral in Cameroon.
Great. And Christelle, sorry.
Yeah, Giselle and Christelle, it's not that far. Merci beaucoup. Merci à Elvis d'avoir modéré cette session. Merci à tous les modérateurs. Merci infiniment, Innocencia, pour le partage d'expérience que vous venez de faire avec nous. Et nous vous souhaitons tout le meilleur. Continuez dans la même logique et nous espérons vous revoir ainsi que d'autres participants à la prochaine édition. Merci infiniment. Elvis?
Yeah, Alison, last words.
Thank you, Elvis. No, I really had a great time. I did join just, you know, midway, but I learned so much. And Innocencia, I'm so grateful to you and your team for all the good work you're doing. This is truly innovative, and I think it addresses a critical need in our context. So kudos to you and your team for the great initiative, and we will spread the word around your work.
Good. And now our chair.
Well, I just want to thank all the moderators in particular for your time, for your devotion, and just to remind everyone that the town hall really belongs to every single Cameroonian who is a health professional, meaning that anything related to health, or who is a health sympathizer, and who wants to bring innovation to Cameroon, and who wants to talk about healthcare problems in Cameroon. And you're all welcomed for us, and everyone can actually present if they have an initiative that they think can move Cameroon forward, or if they have a solution to a healthcare problem which they think we can talk about, reflect about. The first thing, as my late dad usually used to tell us, was that you don't solve problems you are not comfortable talking about. You need to, first of all, get to the point where you can talk about those problems. Acknowledge that they exist. Then you can find solutions. Others may actually label you as someone who talks a lot, but at least talking a lot is raising the problem in the first place. Actions are going to follow. So the platform has been, it's baffled all my expectations, Elvis. I know you know that. We started this 2 years ago. We're talking about this like it's just having to educate people back home about COVID, but it has grown to something bigger than that. Elvis and I tried to change this to a monthly event, and the platform almost chastised us for trying to do that. So Elvis, I want to thank everyone. I want to thank Kenji. I want to thank Dr. Ivon Titab for his time. He's a very busy man, and for making his time here. I want to thank everyone who is here today. Riza, there are many others who join us all the time. Terence Abor, who is a big scientist and a football fan. I don't know how he finds himself here now that others are playing. So I'm really amazed with everyone who is here. And the last but not the least, I just want to thank, as I call her, Guy. She's another sister to me. I was very amazed. I've been following her on, it's been a long time, but I've been following her on Twitter and also on LinkedIn and seeing what she's doing. And I thought it was very amazing. Charity begins at home, meaning that you need to start by valorizing those you know who are doing things, who are trying to change the world. And she was an inspiration to me since I was a child, and we grew up together. And I'm happy to meet my brother and friend, Kingsley Kwala. We go a long way, so we discuss out of the platform, and I want to thank him for supporting, also coming in to support our elder sister. So Elvis, thank you very much. And it's always a pleasure. And really, I want to thank all the moderators for your time, please.
Thank you so much. Thank you so much, Mono. At least I know one person that I can call to ask about your childhood. That is Kingsley Kwala. You'll hear from me soon. I want to know some of those things Mono used to do in the quartier. It's a pleasure to have you here. It's a pleasure to have all of you. Now I'll give the chance to Innocencia to give her last words before we end the session. Innocencia?
Hello?
Yes.
Hello?
Yes, we hear you.
Hello?
Hello, we hear you. Okay.
Hello?
Hello, do you hear us?
Can you get me?
Yes.
Yes, we can hear you.
Okay. I think we would want to thank everybody who have taken time to attend this town hall for today. I want to say that the Cameroon Town Hall for Healthcare Professionals have grown tremendously. We now have on our database a total of 1,120 registered participants. These are Cameroonians who are healthcare professionals, medical doctors, neurologists, scientists, public health experts, lab experts, nurses, and all kinds of professionals you can think of on this platform. 1,120 registered members. So it doesn't matter the number you see that attend the live show. What matters is the fact that all those people get the link on YouTube to watch these sessions thereafter. And so you can be sure how much impact that this platform is having on the healthcare sector in Cameroon. We've had all kinds of guests on these platforms with different expertise, and this is just another moment we are delving into another area of interest, which is nursing, and I hope we are going to have some more speakers that will take this conversation further. Thank you so much. It was a very nice time spending it with you this Saturday. I want to wish you all the best, hoping that we will be able to meet here in a fortnight here for another edition of the Cameroon Town Hall for Healthcare Professionals.